Good morning. Well, looking at myself does not really make me less depressed. I tell you, I'm bummed out. I thought I should share with you that I'm bummed out because I'm sure that those of you that are going through this are also bummed out. So, let me start at wherever I can start. Today's day 15, I guess, since my surgery. I take the Tylenol, and Tylenol is known for making you depressed. So, that's one thing. And I got off the hydromorphone. I stopped taking it yesterday or the day before. Yeah, I think I've been off it for 2 or 3 days because it's morphine and I don't want to be addicted to that. Got enough problems without adding an addiction to it. So, I don't really have problems. I'm just not looking at the positive. If I look at the positive, I have no problems at all. So, I have this bandage and I was supposed to change it, the big bandage that they put on the hospital, which is this huge honkin' bandage that was waterproof. And I took that off, or I went to the clinic and they took it off and replaced it with a smaller bandage. And then I went back the next day and they replaced that bandage with another one. I suppose this is one day at a time so I can wash, but I haven't been feeling like showering. I mean, that's just one thing that is just an extra pain-causing thing that I don't really need. As you can see, you can probably tell I haven't showered. Oh, Nancy didn't shower. Nancy didn't shower. Anyway, showering is not my number one priority. Anyway, so if I showered today, this is the last day I'm supposed to take the bandage off after this. I'm supposed to have it off yesterday or something. I don't know when. 7 days after she put it on. She put it on Sunday. Then the 3 days of the single day bandages, so 10. Plus, I started on Thursday, Friday, Saturday, Sunday. So 13 days. So I guess by day 14, I'm supposed to be bandage free. And I look at the bandage in the mirror, and it was put on when I was laying on my side, and so I guess it was nice and smooth. But when I stand up, it's all bumpy. On account of how lumpy the skin can be when it's not smooth. That didn't make sense. Anyway, so I was able to lie on my incision yesterday, but I'm not ready to not have anything over it. You know, I'm just scared that I'm going to do something to it. And there's also these little steri strips. I didn't have staples or sutures or anything. I had steri strips. And most of them have come off. I don't know how many are left. And it would probably be better to go to the doctor and have them remove it and take off the steri strips that are loose. But I just don't want to have it uncovered, you know? I don't want to roll over onto it and, you know, what if I get bits of grit that get in my bed, you know? What if I get grit in it? And I'm always having to get up and wipe out my bed because I wear my socks and they pick up grit. And anyway, sometimes I take my socks off and then I have to wipe out the grit anyway, and the grit moves around in the bed. Grit. Do you have problems with grit in your bed? Not a thing that people really have to deal with too much. If you have a clean house, you probably don't have grit in your bed. Of course, if you're me, you probably don't have a clean house. Anyway, so those are my fears about my thing. I don't want to rip it. I don't want to do anything to it. Just, you know, they say it'll heal faster if it air dries. But you know, my surgeon that did this, they had me change the bandage and put Vaseline on it every day, and they never left it off. I had the Vaseline on it even after the bandage was off. We had Vaseline, and it left no scar. And that's the thing she said, that it's a Mohs, M-O-E-S or M-O-H-S. Some different kind of procedure. Anyway, and as a plastic surgeon, she deals with scars and not having them. Anyway, and so I don't think it's a problem to leave it covered up. But I also have some pain cream, and it might be nice to put the pain cream on it, because you can't put pain cream on it when it's a dry bandage. But then, do I want to put anything on it? Do I want to take the risk it'll make it moist? Do I just want to let it dry up and go away? Of course, when stuff dries up, it starts to itch. Anyway, it's itched a little bit now and then, not much. Okay, so that's my number one big problem is this incision. I don't like going to the clinic to get it changed because people go to the clinic that have the flu. I don't know why you'd go to the clinic with the flu because there's nothing you can do for the flu except be put on intravenous so that you're not so dehydrated. My family has the flu. It's gone through their whole family now. Except the baby. The baby's happy, smiling. The mother's just dying with the flu. And little Desmond's standing there looking so... He doesn't feel good. But his language skills are so good, and he says, so are you still sick? No, I'm feeling better. This little 2-year-old. He's so sweet. But he's coughing now. And yesterday, Mommy and Daddy were lying around being sick, living with him. Poor little guy. And little Maya, she's just happy as can be, looking up at Mommy. While Mommy's just looking up at her and then smiling. Little baby. I hope she doesn't have the flu. How old is she now? August, September, October, November. She's 4 months. I'm sure she'll survive it. It's hard to take care of sick people. Very hard for Lida to be sick and taking care of 2 children. And here I am, and I can't go over there and help her. I would just go scoop one up and bring him home. And keep him on my lap and play with him. But I can't take a risk of getting sick. I don't know why. I guess I just don't want to deal with everything plus being sick. Mostly I didn't want to get an infection on my scar. They say that if you get any infection, they have to open it up again, and they have to remove the infection from the implant because it'll stick to it. They have to take that out, put in a temporary one, and leave the temporary one for a month or 2, and then go back in and put in the first one. So you have 3 surgeries in altogether if you get an infection there. So I don't want an infection, and they were very careful about infection. And so far, so good. I don't know if I'm out of the woods yet. And the thing seems to have covered over, healed up. So I talked to the physiotherapist, and he's going to come tomorrow. So what? Anyway, that's how I am about, and it's depressing weather. If it was beautiful sunshiny weather, I could go sit out on my balcony. could probably anyway. I have to be much better today with taking my pills on time. I was not only not taking my hydromorphone, but I was not taking my pills every 4 hours. I was getting sloppy. I take them every 5 hours, and last night I took them every 6 hours when I was sleeping. Usually I get up in the night, or Willem does, and bring me my pills. It's interesting watching these chickadees fly through the branches to come over here to the window. Their feeder blew off the thing yesterday, and it's down on the ground there now. Anyway, so there we have it. So, the only thing for it when you feel bummed out is to say a prayer. So I said a prayer, so I'm not so bummed out. I prayed, I thank the Lord for these medical advancements that make these things possible. And there is hope. There is hope that it will not last forever. It will be soon gone. I have some rearranging that needs to be done in here. But I can't do that. Anyway, so there you have it. That is the day 15 update. Goodbye.